Good morning. Welcome to Salina Regional's Morning Medical. I'm Mike Maddock. Thank you for joining us. Today's program, I have with me Dr. Kraig Bertram. Dr. Bertram is one of our new pediatricians. Welcome to Salina Pediatric Care.
Thank you very much. Thank you for having me.
Why don't you tell us a little bit about yourself?
Well, so I was actually born and grew up in Kansas City, kind of the Overland Park, Olathe area. I did my undergraduate education at Kansas State University, did my medical school at the osteopathic school in Kansas City. My pediatric residency I did at Children's Mercy Hospital in Kansas City. And for the past 3 years, I was actually in Coffeyville, Kansas, which is a small town in southeastern Kansas, where I did private practice.
I think I always like to, when I talk to physicians is, were you always interested in pediatrics, or what got you into pediatrics?
Well, I've always really enjoyed working with youth, athletes, adolescents, that kind of stuff. So there was always a natural draw to go into pediatric medicine. I like playing with kids. I like being able to spend time around my children. I like being able to help educate, and that's always been kind of a passion, is working with younger people. So pediatrics was just kind of a natural fit for me.
Yeah, and I think you also have a little bit of interest in some of the sports medicine as well.
Yeah, I've really enjoyed coaching youth athletics when I was a little bit younger and had a little bit more free time. So now, I like to work doing sports medicine also, because it gives you a chance to really help out younger athletes who can really benefit from some direction and teaching and education.
I think one thing that I hear this as a parent myself, and also what I hear from a lot of parents is, when do you call the pediatrician? At what time? At what cough? At what temperature? Sure. And maybe try to help rest some minds, to know it's okay to pick up that phone and to call you guys.
Oh yeah, definitely. We're always happy to get calls. You can call our office anytime from 9 to 5, and we'll try and work with you on the phone. The difficulty with doing anything over the phone is, to do my job well, I have to be able to see your child and examine your child and make sure that there's nothing more concerning going on. So while we're happy to take those phone calls, sometimes it's easier to call up and say, these are my symptoms. Do you think I can get into the office today? Because really we're good about working kids into the office and making sure we're seeing them. Because if a parent has a concern, that means I need to have a concern. Because if they're going to take the time to call our office, it usually means that there's something going on that they would feel better if the doctor took a look at.
Welcome to Salina, and thank you very much. Thanks for being on the show. Thank you for watching. For more information on this or other medical topics, please visit srhc.com, like us on Facebook, and follow us on Twitter.